Okay, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh, and very good day to all students. So jadi kita sambung we will continue on the second part of the lecture for week 7. It will be standards and requirements of biomaterials and medical devices. So in this particular part, we will look into whatever standards related to the biomaterials and the medical devices that are required to be followed before it is being used or they are being used in whatever applications. So number one, in the US, we have Center for Devices and Radiologic Health, which responsible for regulating firms who manufacture, repackage, relabel, and/or import medical devices sold in the United States. CDRH also regulates radiation-emitting electronic products, medical and non-medical, such as lasers, X-ray systems, ultrasound equipment, microwave ovens, and color televisions. So they are one of the center that is closely related to the standard and regulations of biomaterials and its medical devices. And for your kind information, the slides for the second part will be quite short, so tak lama. The recording video will be quite short as compared to the first part. Let's take a look on classification of medical devices. Okay, based on the duration of the device use, invasiveness and risk to the user. We have number one, class 1 devices. For example, crutches, bedspans, tongue depressors, adhesive bandages, etc. with minimal invasiveness, does not contact the user internally. And then we have class 2 devices. For example, hearing aids, blood pumps, catheters, contact lens, electrodes, etc. It has higher degree of invasiveness and risk, but relatively short duration. And then we have class 3 devices. Examples are cardiac pacemakers, intrauterine devices, intraocular lenses, heart valves, orthopedic implants, and they are considerably more invasive and can pose immense risk to the user implantables. And then what is the difference between biomaterial and medical device? It is important to know that the FDA neither approves materials nor maintains a list of approved materials, although they recognize that many of the currently available biomaterials have vast utility in the fabrication of medical devices. The properties and safety of these materials must be carefully assessed with respect to the specific application in question and its degree of patient contact. An important principle in the safety assessment of medical devices is that a material that was found to be safe for one intended use in a device might not be safe in a device intended for a different use. Accurate characterization is an essential step in selecting a material for a medical device, but ultimately the final assessment must be performed on the finished product under actual use conditions. Now let's take a look on the standard ISO 10993, which is quite familiar and quite famous, quite popular for biomaterials and related devices. And the structures of ISO 10993 is as per written in the table. For example, number 1, we have evaluation and testing within a risk management process. Look at number 3, test for genotoxicity, carcinogenicity and reproductive toxicity, irritation and skin sensitization, sterilization residuals, dan macam-macam lagi lah. And actually in total we have 20, and then we have 20 structures of ISO 10993, including systemic toxicity, toxicokinetic study designed for degradation products and leachables. Dan yang nombor 20, the last one will be principles and methods for immunotoxicology testing of medical devices. Among other than that, we have another standards other than the revised version of 10993. Okay, other than that, we have basically this one is meant for 10993, the revised time to time. 1 sampai 20 ataupun oh sorry, there is the details of the structures for the standards. Okay, biocompatibility, kita tengok balik biocompatibility sekejap, guidelines for biocompatibility, evaluation, testing, the risk of management process. Lain sikit. So untuk biomaterials and biocompatibility testing, kalau dia tidak ada extension number dekat belakang, okay, dia akan jadi yang pertama, and then followed by the second one, evaluation and testing and the risk of management process. Kita ada detailed description of that. We have animal welfare requirements yang ketiga, dan dia follow lah. So test for okay, alright, dia ada kaitan dengan list the table tadi. So it is in the table for the description, it is written the details of the each structure of the standard ISO 10993. Okay, macam-macam So for example, selection of reference materials, we have number 9. The standard gives guidance on selection and qualification of reference materials for biological tests, usually sent by the client, right? And then we have, for example, we have another sample preparation and reference materials. Soalan ni ada keluar dalam mid-sem exam nanti, insyaAllah. From this detail table akan ada keluar satu soalan on the standards ISO 10993. Look at number 13, requirements, specific requirements, or the standard specifies requirements and gives on the procedures to be followed in the preparation of samples and the selection of reference materials for medical device testing in biological system in accordance with one or more parts of ISO 10993, specifically ISO 10993-12 semicolon 2012 addresses the following: test sample selection, selection of representative portions from a device, test sample preparation, experimental controls, selection of and requirements for reference materials, preparation of extracts. It is not applicable to live cells but can be relevant to the material or device components of combination products containing live ataupun live cells, living cells. So ada banyak sampai 20 in details. Okay. Then let's take a look on the compilation of international standards and regulation guidance documents for evaluation of biomaterials, medical devices, and 3D printed and regenerative medicine products from the Journal of Toxicologic Pathology, Volume 47, issue number 3, published in year 2019. We have to study the article, study over the article together. I've uploaded it in the ULearn, if I'm not mistaken. Kalau tak ada, tolong maklumkan kepada saya. So let's take a look the relation between international standards and guidance to evaluate biomaterials, medical devices, 3D printed and regenerative medicine products. Okay. And then we have another standard. We have ASTM, American Standard for Testing. Saya tak ingat. For medical device standards and implant standards, ada ditetapkan based on ASTM. They are instrumental in specifying and evaluating the design and performance requirements of a number of biomedical materials, tools, and equipment. These apparatuses are used in surgical procedures that involve the placement of such devices to specified parts and structures of the body, both humans and animals, for the purpose of enhancement or as an aid in a disability. These medical device and implant standards allow material and product manufacturers, medical laboratories, and other concerned institutions to inspect and assess such instruments to ensure proper quality and workmanship. That is what is written under the medical device standards and implant standards. So this is the link. You can take a look over the link untuk tengok macam mana standards under ASTM on the medical device and implant standards and implants. Alright, jadi ini saya ada sedikit pembetulan. Saya teruskan, nanti saya apa nama? Sekejap Okay, topics from biomaterials that will be covered in mid-sem exam. The date will be 7 of December. Sekejap saya save. Ini kita akan bincangkan we will discuss this. No final exam for this ataupun for this subject. Okay, topics to be covered is actually like this. Everything in the slides starting from chapter 1 until 7. That is the only thing that I can say to you lah. Okay. Among them, we have we will discuss this one. We will discuss on the revision on how to find suitable journal from Google Scholar. My very last note for you is that I need you to be firm on 7 December to be in a very good environment with a good internet connection, because I will ask you to find journal article from Google Scholar, for example. You need to do analysis. You need to do analysis from the journal in order to answer one part of the question in the mid-semester examination. So sebelum saya terlupa, saya bagi tahulah, saya takut you lupa ataupun saya takut saya sendiri lupa. You kena mencari journal artikel dan you kena buat analisis. Apa nama itu, characterization macam mana, as well as dia punya mechanism macam mana. Ada saya dah siapkan soalan, so you kena ada internet yang baik. Okay, yang penting kalau soalan ataupun journal you sama, mungkin saya akan semak habis-habisan sebab could be ada students yang akan dapat journal artikel yang sama. Tapi kalau contohnya saya tahu you berkawan, contohnya Lingges dengan seorang lagi siapa kalau you buat journal artikel yang you dapat tu adalah sama, dan saya akan penalize kalau you berlakunya unsur-unsur plagiarism, meniru dan sebagainya. Okay, that's all guys. Thank you for your time. Next week will be mid-semester break. And the week after will be the week 8. Kita akan sambung on the new part of the subject that will be green materials. I'll open we will open a Q&A session in the personal message, WhatsApp or in the group as well. You boleh tanya apa-apa saja. I wish you all the best. So next I will be meeting you on the, I think today is 17, 23, 30th of November 2021. All the best. Thank you. Assalamualaikum warahmatullahi wabarakatuh. Thank you guys.